Hello, everyone, and welcome to this week's episode of the Scenic View podcast. I'm your host, Jonathan Owens, Communications Director here at Scenic, joined by Artis Watkins, Executive Director, Scenic, Government Relations Director, Suzanne Beasley, and podcast producer, Sam Klein. How are you guys holding up against the heat?
Shoo!
Okay, we'll get into that and
weather
more.
minute.
Huh?
I'm not holding up against the heat.
We complain every week now about the heat, but
And it
come
just-
on. This week,
It is brutal.
It just keeps getting worse. And with that in mind, let's have a great podcast. Today is June 25th. It is a Wednesday. We're here in the podcast studio. We have an extra special guest this week. Thomas Friedman from the State Health Plan dropped by for a long interview on lots of important topics to state employees and retirees.
yes, you're going to want to stick around and listen because Thomas runs the health plan. I mean, he hit the ground running when Treasurer Briner tapped him to be the executive administrator of the State Health Plan. There is a lot going on there, and you're going to want to listen to this.
Yeah, lots of information. We talked about the CVS Caremark debacle that's going on with the PBM plans, which we'll explain in a few minutes here on the interview. Also, we talked about the premium increase that's expected later in the summer and starting in January.
He was a good sport. We did not hold back, y'all.
Yeah.
We asked him every single thing we thought y'all'd want.
Artist's not going to hold back. But she was nice about it.
He knew coming in.
It's
We're
not
going
our
to ask
first
those
rodeo with
questions, but
Tom.
that's what I
Yeah.
appreciate about Thomas.
Yeah.
And about Treasurer Briner. They're not afraid of answering hard
Yeah.
questions. They know that running the health plan is really complicated and it's going to be some hard questions involved.
And I noticed that he didn't really skirt the issues either. He
Never, no.
took it on. And that's what you need in someone at the State Health Plan.
Mm.
So before we get into that, we always start with the budget. But since it is so hot out, I want to just address quickly a story from the News and Observer. I think it was today about several of the state's correctional institutions still do not have air condition, or I'm not sure if it meant they were broken or if they just never had them.
Some of them have just never
Never had them.
them.
Yeah. Do you think those are mostly in the mountain areas, or is that like,
No.
it just seems like in the last,
No.
50 years they would have gotten air conditioning, right?
It says in the article, by the way, to give
Is this
true
another
credit
shout
here.
out to Dawn Vaughn again?
No, this is actually Ronnie Butts
Oh,
from News
good
and
job,
Observer.
Ronnie.
And it says that more than 1 in 5 of the state's prison beds, or 21%, still don't have air conditioning, according to the DAC website. That's a double-digit drop from a year ago. So almost all
What?
prisons now, it says, have either air conditioning systems or installation projects in progress. But Johnston and Lincoln Correctional Institutions are the only prisons in North Carolina that have made no progress towards installation. Well, that's obviously super dangerous, but 10 prisons are undergoing the installation process. Brown Creek in Polkton, Columbus and Whiteville, Craven in Craven, Franklin in Franklin, Harnett in Lillington, Lumberton in Lumberton, NCCIW here in Raleigh, Warren in Warren County, Craggy
Yeah.
in Woodfin, and Terrell Work Farm in Columbia.
So our first vice president, Wendell Powell, works at Harnett Correctional. So
I can't even imagine right now.
No.
can you imagine? Yeah.
No,
Like,
so, I mean, you're trying to do your work, and you're having to wear what they
All
have to
that.
wear.
Mhm.
Yeah.
And then the offenders are not going to be in a good mood. They're living without air conditioning. So if you're just trying to keep a place peaceful, it's going to be that much harder. As we know, crime waves go up during heat waves and
Mhm.
everything else because human beings become very hair trigger about our emotions. So
And the
if you're working
smell.
in a prison
Yeah.
Yeah, it can't be
that is
good.
not air conditioned, bless your heart, we're thinking of you right now.
And
We
you can't-
cannot do what you do, and you don't get paid enough to do it.
And you can't go outside to get any
Right.
kind of relief.
Yeah.
So-
Yeah, and you can't close. We were talking about this earlier today because the way this story was being reported, was inmates are
Yeah.
in these prisons without air conditioning. I get that because they are, and they didn't choose to be there. But you know what? The staff's without air conditioning as well. And
Yeah.
I just thought it'd be nice if somebody.
Yeah.
I didn't like the way these things were titled
Yeah.
or captioned on social media. Everybody's in there together. Not
I-
good for anybody, but nobody can leave.
Exactly.
Yeah.
On Twitter, we pointed out that they can't just close down the prison and leave for the day, you know?
Yeah, exactly. And so this kind of brings us to a budget issue because who knows where that's going to end up, and Suzanne will get into in a minute. But even the biggest amount that's been recommended for folks who work in prisons, correctional personnel, The biggest raise that was recommended in any of these budgets was less than what was being recommended for teachers and principals. You could get into who deserves more or who do we need more. We need all of those people, and we need them to be good quality people because other citizens are relying on those people.
Mm-hmm.
And all of us are relying on them to do a good job. But how can you possibly say that people who work in a prison or an HHS facility that doesn't close down necessarily, I don't know about HHS facilities, but prison that's not going to close down because of no AC should get less of a raise than somebody who works in a place that is going to, for safety reasons, because it's our children they've got in there, close down in that situation. So not to take one thing away from teachers or principals, but to say, for goodness sake, if this doesn't drive home the point that there's a lot of other people in state government that cannot DOT, they're out there working on these roads and dealing with things no matter what the temperature, no matter what's going on. So it is absolutely wrong to pick winners and losers. If you've got a limited amount of funds, disperse those across the group.
Equity.
Unless there is a huge public safety issue. That's my rant.
Was a good one.
If anything, you need to reward those people for sticking it out, especially in places like these prisons where there's no air conditioning.
And I'm assuming I spoke with a former prison warden this morning who said, back in his day, he's retired now, but back in his day, they had like these 5x5 huge fans, and that was it. That was all they had.
Yeah.
I just can't even.
Oh, I wonder how the air circulates in some of these places too.
And you're talking about hiring someone to work in a prison.
Yeah.
At barely above $15 minimum wage, that state employees have a $15 minimum wage. Why are they going to do that?
Yeah.
Why are they going to, who's going to do it? Who's going to be really likely to do it is somebody who might want that job to start a criminal enterprise.
Yeah.
I'm not kidding. Because obviously this happens.
Well, if you're not paying people your pool of
you're gonna end up
potential
running a higher risk of having more people come in who are only taking that job to do something that's not right.
And if you're
put
not
everybody at risk.
And if you're not paying substantial raises, what is the incentive to stay once you've
that's right.
already taken the job? So speaking of budget, there was some talk this week about the mini budgets that maybe come out. One of, I guess, the House's mini budget included information on raises. The Senate's did not,
The Senate did not. Most of the language in the Senate's mini budget, was like continuation spending. And the House budget today, they released something too in the form of a mini budget, and it did include first year pay raises. 2.5% was in there first for actives, and a 1% one-time bonus for retirees. None of that was spelled out in the Senate mini budget. At the end of the day, they're going home this week, folks. They're wrapping up and they're going home. So at the end of the day, those mini budgets are in no more of a position to pass than the big budget is right now. They're so far apart.
Yeah, I think I saw a tweet from Colin Campbell that it may not have been Colin. It may have been. I'm sorry. That they did these in an effort to reach some sort of compromise, and then they're even farther apart on these. So it doesn't look like these things are going to pass, right?
But there was a group that we take a lesson from this week.
Indeed.
Oh, man.
Indeed. So it was shrimp trawling week.
Which, if you are saying shrimp trawling, because I never hear that term, obviously, it's what most of us grew up calling shrimpers.
Yeah.
That's all it is.
And there were a ton of them in the building yesterday, and my understanding today, too.
They won. The bill.
Yeah, they won. The bill.
They did.
Yeah.
So if that's not
it said the shrimp bill is dead.
I had to get
one person did get arrested in the process.
Yeah, well, there's got to be one in every bunch, right?
We got to have shrimp puns. Can y'all work on?
but
there's plenty of shrimp puns.
So huge cheers erupted from the people hanging around who were there in the crowd. The crowd is ecstatic. The shrimp bill is dead. House Republicans proclaim after coming out of caucus meeting. Bill will be held in rules and go nowhere. Several members tell me. This is Brian Anderson who was posting this. Look, the shrimpers came down there and they got hurt. Now, state employees and retirees, listen up. You came down there on House Bill 549, the one that would have given auditor the powers to make every single person in his office a political appointee. You came down and you said, this is flat out wrong. And that didn't end up happening because you came down there and said, this is flat out wrong. You need to call every House member, every senator, the governor, your neighbor, everybody, and tell them that this is nuts to propose on either side 1, 2, 3% raises for state employees and next to nothing, 1% one time for retirees. After taxes. Like,
it's nothing.
No kidding. That's going to be about $15 a month for them if you averaged it out over the year.
Yeah.
If you think this is wrong, while we have right now in this state almost $700 million going towards scholarships for people to send their kids to private school, no matter how rich they are, no income cap on getting some of that money. So if you think we've got $700 million as a state to spend on sending rich people's kids to private school, which, by the way, everybody who's got kids in schools telling me these private schools are increasing their costs, like you said a few weeks ago, John, by an amount that kind of covers that bonus. So we're handing money to an industry that's private schools for no apparent reason. Only 8% of the people who have moved their kids have moved from public to private school. The rest of them already had their kids in private school.
That's probably equates to about a 5% raise for state
so we either
right?
have money as a state, and we're so rich as a state, we can throw almost $1 billion towards people who are already rich to send their kids to go to private school, or we don't have that kind of money as a state, and we got to tighten our belt, which means we have to give piddly raises.
Yeah.
But this is nuts to me. This is nuts, and you can't tell me the taxpayers would say, I'm cool with that. As long as you put the word choice in front of it, I am cool with you giving rich people my tax dollars.
Yeah, and so retirees, if you really want a COLA, that's
what you need to
source
point
you
out.
need to point out.
Because this is
it's $561 million for 1% of COLA.
So okay. But yeah, I mean, it's
incredibly
obviously.
expensive.
But you know what? Here's what gets me. We're told, hey, we're all about parents having the choice. Okay, I'm fine with that too. But how many years have we been told as lobbyists, state employees have a choice? They don't have to work for the state. If they work there, they know it's going to be like this.
Mm-hmm.
Yeah.
Okay, choice for them is supposed to mean a vow of poverty, apparently.
Yeah.
Yeah.
But choice for parents means no matter how rich you are, we'll hand you the money.
Choice for private school parents. Well, just take a lesson, state employees.
Yeah.
See all those big transfer trucks going down the street
that
this
was
week with shrimp.
Crazy.
Excellent
Just
job,
remember,
shrimpers.
I'm
when you-
telling you.
When you take action, nothing is shrimp possible.
Oh, no, you didn't.
Oh, I worked on that one hard.
I'm happy hearing about that because yesterday when I saw it, when I was looking at the news, I was like, well, even as they stated, if you push them further off the coast, that's not where they're going to find the shrimp. They're not going to find the shrimp there.
See, I had to get a lesson from both Artis and Suzanne on this bill because it was very complicated to me too. Now, apparently it's the inland waterways, right?
Yeah, but my understanding is, well, I don't want to get deep into it because we have Tom Friedman coming on and this is going to be a long podcast
we don't want to
already.
get too deep.
So I don't want to get deep in the shrimper podcast issue. I just want to say the shrimpers did it right. We need to do this. Members, if you're hearing this, make those phone calls today. Come down here. We've got lobbyists down there all the time.
Hell yeah.
Oh, he's going to keep going with the puns. We're done with the shrimper conversation.
I'm just happy that kind of failed because my thought was, well, if they're not catching as much shrimp prices are going to go up. And I like shellfish.
I do like shrimp.
I love a good shrimp boil.
Anyway, let's get to Mr. I didn't ask him if he had a title like doctor or anything.
He's executive. Oh, no, like that.
So I just assume Mr. Thomas Friedman, executive administrator of the state health plan. It was a great interview, and I hope you enjoy it. So we're pleased to be joined today by a special guest in the podcast studios. Do we have a name for the podcast studios yet?
No.
The P.D. Pablo podcast studio.
Not everything got to be P.D. Pablo.
Thomas Friedman, the executive administrator of the state health plan, is here with us today to talk about some exciting things with the state health plan.
Thank you all for having me. This is also my first podcast.
Oh.
So
Yay.
cracking a lot of ground here today.
Oh, wow.
Perfect. Man, I can't believe we beat Do Politics Better to this. But yeah.
I know.
There's got to be a lot of
Take
people.
that, Brian and Scott.
I don't think you're selling yourself enough. You should get out there and do some podcasts.
Yeah, I got
You're a
to
celebrity.
speak to the folks on the plan before I speak to anyone else.
That's right. Yeah, you
Fair
have
point.
a lot of
Fair point.
Yeah. So he is here today because, well, obviously the state health plan is paramount interest for our members. What do you have, about 750,000 people on the plan now?
About 776.
Wow, that's a lot of people. That's about, what, 1 in 10 people in North Carolina, almost 10%?
Isn't it 10% of the commercially insured?
I think there is about 11 million-ish people in North Carolina, so just under 10%, but we are 10% of the commercial population in the state. And I believe, other than Mecklenburg County, where I think we're 5th, we're no lower than the 3rd largest commercial provider in any county in North Carolina.
That's amazing. And are there any private insurance companies that are close to that?
Well, Blue Cross was still the biggest. There's no employer that's even directionally close.
Yeah,
Mhm.
yeah.
Bank of America is pretty big, but they're all throughout the country. In North Carolina, we're orders of magnitude,
Yeah.
kind of bigger than everyone else.
And we've always argued that with that becomes a lot of buying power, a lot of power to make changes in healthcare in North Carolina. North Carolina ranks as the lowest state in the nation for healthcare, according to Forbes, right?
Meaning it's the most expensive.
Most expensive, yeah.
Not lowest, worst.
Yeah. yeah.
The worst.
Worst.
My
Yeah.
direction.
Well, I mean, aren't there 3 things they look? The Forbes one, that there's 3 things: the cost,
Uh-huh.
the effectiveness of the care, right?
Mhm.
And the access to it.
Yeah.
We got a lot of care. That's good.
Can't always get that care, though.
Yeah.
Mm.
But the
Accessibility
cost
is a
is
thing.
the worst, the most expensive in the country. It's just terrible.
And with that in mind, it was earlier this month, around June 8th or 9th, there was a story that came out that you guys were kind of at odds with CVS Caremark, correct?
Yes.
Who is our pharmacy benefits manager. Can you explain a little bit about that?
Well, you'll have to explain. Somebody listening may not even know, why do we have a pharmacy benefits manager? What does it mean?
Yeah, so thank you for that primer, because I would have jumped way into the deep end.
We've had to learn.
I do
It's
that. I
taken
do
us a
that
while.
too.
It's
so-
best to begin at the beginning. So a pharmacy benefit manager, when our members go to the pharmacy, there's someone who has to negotiate what the price is for the drug, pay the claim, and then dispense the claim. So when a pharmacist buys a drug, they pay a price, and then the PBM negotiates with both local pharmacies and sometimes their own. So like CVS has their own pharmacies, and then local pharmacies on the price for that drug. And that's one area where scale comes into play in a good way for us. The bigger the PBM, in theory, I'm going to say in theory, the cheaper the drug price would be for our members and for the plan. Is kind of fundamentally their role and responsibility. That is, generally speaking, probably pretty useful. Someone's got to process those transactions. That's where that industry started. It has evolved into them doing care management, formulary management, a bunch of other services that I couldn't tell you in good faith I'm entirely convinced are the right things to be doing for members. But at a point in time that I think they sensed an opportunity to generate more revenue, more profit. So they started as someone who just processes the claims. Very useful. We can't do that ourselves. When you think about like Stripe or something like that with Apple, but you need someone to do the step of processing it. And, that's definitely worth a couple cents a transaction. Unfortunately, that business has ballooned into a bigger set of services. And something I know our members hear a bit about is rebates.
Yeah.
On drugs. So if our member goes to get a drug, we've negotiated a price through CVS for the drug. So let's say CVS said, hey, this drug's going to be $100. Then the company that manufactures the drug says, for every time you give our drug out, we'll give you some money back, CVS, on that $100. So now the drug only costs the state health plan $50. I think the first logical question would be, why wasn't it just $50 in the first place?
Mm-hmm.
And that's sort of the crux of the issue we got into with our PBM in some ways. And first, I want to give credit where credit's due. I think Treasurer Falwell and the team did a tremendous job negotiating our most recent PBM contract. And because it was so ironclad is a lot of the reason we have so many problems today. So how rebates usually work in a contract is we, the state health plan, get 100% of the rebates for those drugs directly passed over to the state health plan. A few years back, PBMs created additional companies called group purchasing organizations that would aggregate the aggregation of rebates. And I say it sort of in jest, but it's true. And now they're making companies that aggregate the aggregate of the aggregating. And that is an actual statement. And so they interpreted the contract to mean, PBMs general, not specific to CVS, said, you get 100% of the rebates that CVS gets. And so these companies that were bigger than CVS said, well, we got you a better deal on the rebate. So we're going to keep some of that money before it gets to CVS. So any PBM would say, hey, in good faith, we're giving you 100% of the rebates we got. And they're not technically the same company.
Yeah.
So
the health plan doesn't see that money back. They don't see a rebate from that.
Correct. There's some money kept there. And our contract was pretty clear that we didn't say 100% from y'all. We said 100%.
Right.
And so when the previous treasurer found out that this was happening, he's like, time out. We're in a pretty tough financial situation here. we'd like our money. So I think that is one of the bigger issues is, are we getting the full value of our rebates? There are some other issues about, I think you hear about PBMs trying to change contracts and not telling folks that they've changed the contract. Our team, and again, credit to Treasurer Falwell and his team, our contract we think is really ironclad. You can't make changes without us saying so. And I haven't said so. So we have some disagreements about, they think they do have some room to make some changes. We're like, no, we don't agree. And you all agreed to these terms. And we negotiated them in good faith. There were several rounds of best and finals. And we didn't change what the words meant.
So not a completely unusual situation, honestly, with state contracts that somebody says, I'd like to change it. And now you're in the position of having to weigh this big hole the health plan has, of $500 million hole, and can't waste any money. You never would want to waste money as a fiduciary of the plan. But what do you do in your situation?
Yeah, this is a good question. So we're asking them, one, to honor the contract.
Yeah.
And two, honor the contract in totality. So some of the more technical stuff that they're trying to work around, be like, no, we agreed. So they owe us some money for that. And it's in the tens of millions of dollars. I would certainly take it and retire happily. I know we got a bigger hole. We got a near $1 billion hole in a couple of years, but it's either the taxpayers pay it, the members pay it. And so we said, no, it's ours. That's right. And then for the group purchasing things, we said, you got to pass all of that money to us. And so that's where we are. And I think we're getting to a good place with them. I do. I think we are going to be in a better place than before when we started. Because again, we're holding them to it. I think one thing I really give the Treasurer Briner credit for is he's also calling this out because there aren't plans of our size throughout the state of North Carolina who have this much time and this much staff to identify these challenges and to identify these problems. And if someone's so bold enough to go after a 700,000 person plan, 800,000 person plan, what's happening to the 25, 35 person plans? I can't imagine they're any less bold, would be my guess.
Right.
So I think we're getting to a good spot to make sure that they're going to honor their contract. Our members are going to be in a better place financially. And it's a contract they can live with. Because the challenge is we're fiduciaries, but I think our first duty is make sure members can get drugs on January 1st. Right? Exactly. So we have to work with them and come to a solution that we can get to. We have a great staff, a really smart staff with a lot of people. I don't think we can dispense drugs to 775,000 people by ourselves. We need a partner. So we're working with them to get to a solution that's better for us and that they can live with to administer the contract. Because again, if we are not getting members drugs, fiduciary duty aside, I think we've already failed a bigger duty.
Yeah.
So just to return to something you just said, it seems to me like from the release that you put out and everything that they're already in breach of that contract, right? So they're...
Yes, I feel very confident we're going to be made whole on that situation. And then when I talked about that kind of big group purchasing thing, I think we'll probably end up in a more favorable situation there than we would have thought.
So, and we had members who were convinced, at least on social media, that this is an Aetna situation. It's because the health plan now uses Aetna for third-party administrator just for the plan. And we were trying to explain to people this is actually a separate contract.
Yeah, so this is a separate contract, and some of the challenges we've identified started in 2023 before Aetna was on board. So that kind of back money stuff, that precedes Aetna being involved.
Yeah, that was our understanding. So, but that's why we said, hey, we'd love to have y'all come on and explain this, because we're trying to explain it. And
well, it's complicated stuff.
It is.
Yeah.
I mean,
but also people were getting mad at Treasurer Briner, who's not done anything here. So we felt like y'all needed to come and let's hear it from the horse's mouth.
Yeah, so I think we're hopefully going to get some resolution on it by the end of the month, and I recognize it's the 25th or 26th, depending on what day this comes out. But I do feel confident we're getting very close to resolution here, and really full credit to the treasurer and the staff for holding people accountable, managing our contract. We have a great legal team. I mean, state employees are great because they're great, and they've really demonstrated here, state employees working on behalf of state employees, to really drive towards what we were promised and what we believe we're owed.
So to build off what Artis was saying about our Facebook comments and things like that, it seems to me that Aetna came in at the exact wrong time for a lot of these things. It seems like they're being blamed for Clear Pricing Project going away. I know we've gotten a few comments about that. And now this whole play, how is that relationship going and how is the transition going?
Yeah, I would say with respect to CPP, that was 100% the treasurer, not my decision for that to go away. So Aetna is going to administer the benefit. They are different, so they deserve critical feedback on a lot of things. But to be clear, the clear pricing project going away was 0% them, 100% the treasurer and I, kind of given our current financial situation. I would say, how the transition is going, I think everyone tries to make a marriage analogy to your second marriage. You've been married to someone for 40 years and then you get shotgun wed to someone else the second time around and you don't realize they snore because you didn't know them that well.
Maybe 20 years younger.
Yeah. So there's definitely been bumps along the way. I think one of the big causes for, some of the confusion is the messaging before the treasurer and I came in was nothing is going to change. And I would argue if nothing was going to change, then there was no reason to switch, right? If something is exactly the same, why stop? I think I can't speak for Treasurer Falwell, but I think they thought it was time for a change. The board thought it was time for a change. And so things are definitely different. They contract with providers a little bit differently. They have different processes, some good, some bad. I think Blue Cross is a tremendous partner. I wouldn't say they were perfect. So, some things that Aetna is doing different are probably different for the better. Some things that they're doing are different. Caroline and my team gives them a hard time about every day. Then we're trying to get towards the right path.
Yeah, Caroline's great.
Yeah, y'all got good people over there, period. I always get responses when I have a member with an issue very quickly. So,
with respect to Aetna and those issues, I think we really do lean on y'all when issues come up to let us know, and we'll try to solve them as fast as we can, particularly if it's a member's health at the point of things. We will try to fix things same day. But, with the tens of thousands of claims coming in every day, the goal is 100% correct and we're going to get there. But when we can hear from our members if something's going wrong, it is infinitely helpful. If they're doing something wrong, we deserve that feedback. We got to fix it. I don't want people to feel that they're putting us out or being rude or being, they got to solve it.
For anybody listening, I have to say anything that it's usually Suzanne or me that somebody will get hold of and scenic and say, this person has a problem. And we'll ask the questions about whatever the issue is. And honestly, the treasurer's staff in terms of the health plan, and the retirement system too, is always very, very, like most state employees, on the ball, conscientious, immediately on it. So we love that. And I know that you have to deal with a lot of other guff from us, and it's around the transparency issue. So I think we need to dig into that just a bit because people would be shocked if I didn't ask you those questions.
I would be shocked.
I know. So if you're listening, you've obviously heard us talk a lot about the fact that these contracts between Aetna and Blue Cross before them are contracts that the public can't see. They're spending public money on behalf of public employees to get health care, but the public cannot see the contracts. Again, North Carolina is the most expensive place to get health care in the nation. The health plan is the biggest plan by a mile in North Carolina. We feel like we're paying too much, and we can't prove it because we can't get the contracts.
Well, I would tell you you're paying too much. I would agree with you. We're paying too much. And kind of going back to something you said, Jonathan, at the beginning, we have not been effective at using our scale on either making costs more affordable or making costs more transparent. And that's something we have been spending quite a bit of time working on. And I think providers will have different challenges with transparency, but where we're trying to go, and something you and I have talked about a couple of times, is I think the treasurer and I are committed not just to transparency, but actionable transparency. We know in a lot of cases we are paying too much. I'm going to use surgical services because that's where a lot of our money is going. We have a lot of choice. Not only do we have a lot of scale, but we have a lot of choice. And when you have those things, you should be paying less. So we've partnered with a company called Lantern Healthcare that's starting 1/1/26. We are going to use that scale more broadly and more transparently to drive down prices. And they have a good number of contracts negotiated on our behalf. Below that 160% of Medicare Caremark, those will be posted what those rates are. And I think the best thing for the members, the member cost is going to be zero. So that's really the carrot we're going to provide those providers. Like, we know you can make money below what you're charging us. So in exchange for giving us a discount that we can publish and discuss with our membership.
Okay, I'm going to stop you right there.
Yes, ma'am.
Because I know we're going to have people on our social media say, what's the difference between that and the Clear Pricing Project? Which was also, hey, if you'll take less than whatever number it was, you can be in this special plan.
Fair stop. I think it's a couple things are different. One, anyone could join the Clear Pricing Project.
Right.
Regardless of access or quality or services you're providing or what your existing contract is. And the challenge with the Clear Pricing Project was, because it applied to everybody, the people that signed up, more often than not, people that made less than 160 got an increase for services, and the folks that made more
Don't want to be part of it.
don't want to be part of it. So where it's different is a couple things. One, not everyone can join in two different ways. One, we kind of have to narrow the funnel so we can use our scale to drive volume to those folks. And two, the program is really predicated on quality. I think MRIs and labs, those things are commodities. We should just pay less because there's no reason to pay more. There are differences in quality of surgeons and providers for some of that care. And the front door for the Treasurer and I is always going to be quality.
Who determines the quality?
So the company we're partnering with, Lantern, has a national panel of surgeons that define quality. And we look at quality in a few ways. Where were you credentialed? How many times have you done the thing that we're going to have surgery on? So I'm going to use shoulders because it's easy. How many shoulder surgeries have you actually done? And what are the outcomes of those surgeries? Did someone have to go back to the hospital? Like, what was their pain thresholds afterwards? Like, how are the patients doing afterwards? So we're using data to determine what quality is, because I think a lot of times in some of these programs, kind of going back to any provider who's going to take the rate,
right?
I would rather have someone who's done 1,000 surgeries in the past year operate on my shoulder than someone who's done it 3 times.
Right.
And I don't want to steer state health plan members to someone who's done it 3 times.
Mm-hmm.
All respect to folks fresh out of school. I'd rather state employees get the kind of the cream of the crop surgeon who's done it the most times, because I think that's the right thing to do. So we've narrowed it by quality and kind of in a way we can measure that makes sense. And 2, making it such that our members are going to get better access for things. So they got to be able to get in faster too. And so that wasn't really a condition of the clear pricing project. I think it worked out that way in a lot of cases because they're like, well, I get more money every time I do a thing. So let's get the people in where we get more money every time we do a thing. So it'll look a little bit different in that respect. So you still can use your normal benefit as it exists today. We're not taking away who's in your network. But if you want to pay nothing or pay as close to zero as you can for your surgery, we're going to create a path there. And the rate is so much less for a couple of reasons. One, providers think they're going to get to do more volume because I think our state employees are pretty price sensitive. They don't get paid the most. And what we learned through the Clear Pricing Project is 30 to 40% of folks are willing to change their primary care provider to save $25 or $30. We're saying, what if you can save $3,000 or $4,000 on a surgery from a higher quality provider who's committed to getting you in faster? We think that is a compelling proposition to members. And again, because it's healthcare, we're not certain everything's going to work 100% the way we think it all the time. We're not taking away anyone's existing benefit. I do appreciate cost sharing is going up, but we look at, somewhere between 25 and 30% of our members would not have had to change their doctor last year and would just pay zero. No deductible, no co-insurance, nothing towards their out-of-pocket. We're going to cover the costs.
That would be good. I mean, so that sounds like a positive step for most people. And some people are going to hate that idea just because they want their doctor, period. And we get that. But we know the costs are going up in terms of premiums and out-of-pocket, everything for the members of the plan. We know there's going to be an option which takes away some of their choice. The final thing they're going to ask about is, all right, so what are we going to do about anybody that doesn't belong to this network that Lantern is going to outline? Are we going to continue just to overpay them when state employees choose them as a provider?
So I think there's 2 ways to answer that question. One, I appreciate folks having a choice on who they use. I would have a very hard, and I've been doing this for a long time in a lot of detail, picking who is the quote unquote right doctor who's going to do the best job. So part of the reason we want to differentiate in their prices, y'all can use whoever you want, but if they're going to continue to be more expensive, won't commit to access, won't commit to quality requirements, you're going to pay a little bit more. So I think the step we're trying to do is make it clear to members.
But it's not just the patient that's going to pay more. The plan.
That's right. And I think over time, we're going to try to push it a little bit more towards the member, because we need to create paths across the state for members to pay as close to zero for possible for getting high quality, low cost care.
Well, could you not do it by saying, hey, all of you providers, we won't pay you more than 250% of Medicare reimbursement rate?
I think the Clear Pricing Project targeted that. And so we could say, no one, we're going to give more than 250, or we could say, for the best of the best, we're going to give 125. So the member is going to pay more, the taxpayer, the plan is going to pay less, and the care is going to be better. So we are not making it just about the transparency of price, but what are we getting for the money we can pay for as well? And this is step 1, right? Is starting with surgery, because that's where most of our spend is, where most of the choice is, and where most of our folks are candidly getting hit the hardest from deductibles and out-of-pocket maxes are those key areas. So I think when we're successful, overall prices will go down, because people will realize if I don't lower my prices or get better at my job or provide better access, my next contract negotiation is going to be real tough, because I think a lot of the higher priced providers can say, it's like, well, I have 2,000 state health plan members, so you need me in your network, so I'm not really willing to budge on the price. We need a mechanism to take folks away from those arrangements. Say, hey, you're getting better care over here. You're getting it quicker. You're not paying anything. So when those folks come to the table and say, I need 475% of Medicare, be like, you guys only got 4 or 5 patients left. Sorry. Like, that's just not what we're going to do. And that,
but shouldn't it work the other way? If they've got 2,000 patients on the health plan, that should be more incentive for them to want to keep the health plan in as something they're in the network.
And I think this is how they're going to feel it, that we've proven over time, I think, that they're not willing to kind of just give a discount. So we gotta pressure them and force them to do it, and hit them where it hurts is taking state employees away from them if they're not willing to do it. Because I think, with the Clear Pricing Project, we saw providers are willing to do stuff for more money.
Yeah.
They're not necessarily willing to do it for less unless there's an incentive for them to do it. So we are really trying to use market forces to say, hey guys, if you don't want to do this, you are not going to get access to state employees, teachers and state employees. And you've all said a lot of times that's your mission and that's a problem you're trying to solve for.
Yep.
So you haven't shown me yet. And so what we're going to do is say, if you don't want to show us yet, and you haven't, we are going to work with the folks that do, and we're going to make it as clear to our members as you can. That's where we would prefer you go. It's going to be cheaper for you. It's going to be better for you. And if you have to travel for things, we're going to help pay for the travel of things. Again, like things are expensive, right?
Yeah, they are.
I wish I knew the exact mileage breakdown and hotel breakdown, but we recognize that is, if we're asking you to do something, we've got to be part of.
Yeah, especially out west.
That's exactly right.
Yeah.
And I think out west is a great point. There aren't as many providers or systems throughout the state as there are in the Triangle or the Triad.
Yeah.
And so not everyone is going to have access to high quality providers who are engaged with the program, but they don't have access to those providers now. So I think some folks are going to have to travel a little bit more if they want to take advantage of this program, which again, we're going to try to pay them for. And I'm a very cheap person, just in full transparency. If you could tell me I got to travel an hour or two to save $200, I would do it. If you told me I'd save $3,000 to travel a couple hours, I'd be like, I am 100. I hope that our members are willing to do that as well. And again, we're going to help you with gas and the travel, because I recognize I make a lot more money than a lot of people. And even though I'm cheap, I still have the resources, and we got to help folks get there. And hopefully this helps drive more practices into more rural areas, because they see the opportunity for them to do better financially, to support their communities better.
Yeah, because that's a huge issue in North Carolina, is the rural areas.
Yep.
Yeah, it really is. I think that obviously there's millions of problems with the American healthcare system. I think you kind of touch on one thing, though, is that like people really don't shop around for care. If your doctor tells you need a surgery,
you just take it.
That person does your surgery,
Yeah.
And so I guess you're saying we need to be a little more cognizant of that, right?
Well, I think shopping for healthcare is really hard. Like I said, I've been doing this for a long time, but I got 2 kids, a job, I got dogs, I got a lot of other stuff to do. And asking our members to do a lot of shopping when it's all really confusing, it's not going to happen. So we're trying to say, we're going to do that step as best we can for you, not ask you to go on a website and look at 58 different things. Just say, we hear you. This is expensive. This is free. We are vetting it for quality and access, to hopefully simplify that, because consumerism in shopping and healthcare has not worked. It is not true.
Yeah.
It might be at a point in time, but we got to make it so simple. And to your provider point, and then we've got to tell the providers, because this is where transparency kind of goes both ways, our primary care providers throughout the state, this is where you've got to refer members. Because, I think about trust, and I'm going to use a hand gesture here. People trust insurance companies the least.
Yeah.
They trust us a little bit more, but not that much. They trust y'all more, and they'll listen to y'all more. But
not that much.
But people trust. Trust their doctor the most. If your primary care provider said, "Hey, Suzanne, you're going to need hip surgery. I can send you here where you've been going for stuff. I think it's going to cost you about $3,000, and it's getting anywhere. Or you can go here." High quality care, and that's part of what we're community providers, and it's going to be free to you. Yeah, again, it's one thing if as a member of the state health plan, that's where transparency isn't just between the plan to the member, but from the plan to the provider, and incenting and telling the provider, like, y'all have a role in this too. Because again, they'll listen to us sorta, but they'll listen to their doctor, and we got to make it not just clear to the member, but clear to the doctors on the front lines that we need you to be part of this because people trust you.
Mm-hmm.
You haven't been given that data. We heard you loud and clear. Like when I tell doctors, I'm going to use pretend numbers, but real practices, but not actual prices. If you go to Raleigh Radiology for an imaging, if MRI, it's $800. If you go to one of the large health systems, it's $2,400. A lot of providers in the moment where they're referring out, they don't know that. That's not the math they're doing. That's not what they're thinking about. And for a member, it's like you're worried about, like, do I have cancer? Do I need back surgery? That's a hell of a time to ask someone, be like, I need you to go on the internet and do some shopping for some of this stuff.
Yeah.
So what we need to do is get those providers to be like, send them to the lower cost place where they can get in faster. It's easier to park. It's easier to get in and out. They do one thing, they do it well. And I think the easiest way to do that is two ways. Make it as free as we can for the member and reward the doctor for doing the right thing, and eventually tell the doctors who don't want to do the right thing because they're part of some arrangement.
Well,
you got to go.
The doctors have all but been forced to be gobbled up.
That's right.
By systems.
And so we're committing to partnering with those folks that haven't been gobbled up with systems because they're the ones who really have the choice.
Yeah.
And they are in, local independent primary care is in 100% of the counties of North Carolina.
Yeah.
And those are the folks we got to partner with because they're going to be the folks in the front line helping our state employees in all 100 counties. Like, hey, this is a hard and scary time. Here's where you can go. Because not only are you worried about your health, but healthcare bankruptcy is one of the biggest issues in the country.
I think it's the leading cause of bankruptcy still in this state is healthcare costs.
So if we can get the system up and going, we can let the folks worry about their health and their health process and make sure the cost is well managed for them. It's still going to be a concern because, again, medication's expensive. All these things are expensive. But we really want to get to that path of this is as free as it possibly can be. And we want you to go to doctors who are engaged in taking you on that journey to those lower cost, higher quality places. Because, again, if we ask you to shop for it, one, it's not going to happen. And two, I don't think that's necessarily fair or the right thing to do when you're going through a healthcare crisis. So that's why we got to set up a plan that really rewards people for doing those things and really rewards providers for going down that road.
I hope that, it sounds good. I hope that works. Again, the worry for us is we've been talking about this health plan for nearly 20 years at this point. But what we've watched is Wall Street become healthcare.
Yep.
10 years ago, even, there was just a tiny number of private equity-owned healthcare systems, and now it's just getting bigger and bigger and bigger, and the issues we used to have with Wall Street transparency on the retirement system side proliferated on the health plan side, and here we are. So what do you think? And Treasurer Falwell famously called them the cartel, talking about hospitals and the way they would band together to kind of fight efforts like this.
Well, the good news is, one, full transparency, I worked at a health system for 6 years.
Yeah.
My experience, I was pretty senior. I would not describe it as cartel-y. I get that they are very price controlling. So not language I would use. And I think part of the reason we've gotten them to come to the table is we've sort of steered clear of that language and try to say this is really about economics and market forces. Like, you want more commercial volume. We have the most commercial volume. To get this, you got to give us a discount. So where it's gone from kind of the theoretical stuff we talked about in March and Tacticals is a lot of those contracts are already signed with ASCs across the state. So, and we are going to show the health systems and all the other entities, like, if you want to play, this is the number. It's not a target based on something. This is a contract that's been negotiated and signed. We're only going to let one of you in from a health systems perspective regionally. This is the number you're shooting towards. And if you say no and you all say no, then I'm going to pick on the Mecklenburg area. Then if we do 100% of our surgeries with Ortho Carolina and our members pay $0 out of pocket, you're going to be losing all that volume. Okay, right. That's your decision. So I think it's less theoretical because some of these contracts are already done and signed. And they range, from 120 to 155 of Medicare. So
wow,
it's less a theoretical exercise and more of a kind of tangible exercise. And that's part of the reason we invite you over tomorrow to talk to them so you can kind of see underneath the hood a little bit more. Because like I said, it's one thing if I say it. I think it's another thing if we could say it together.
And I appreciate you're trying to approach this in a more, maybe a less confrontational way, maybe, than Treasurer Falwell liked to approach it.
Yeah.
He was pretty doggone frustrated. Yeah. But I have to say, when we see the headlines like we talked about recently, where a healthcare system, one of the biggest ones in the state, was giving 41% raises on average to its leaders. And we know state employees are crossing their fingers for 2.5% plus their health care is going to go up. They're just having a really hard time understanding how this system, of course, it's our whole country, really. Yeah. But how can we have a system where we don't think something is wrong with it in terms of how the hospitals operate if they're able to give 41% raises to their top folks?
I wish I had a perfect answer for that. And where I will give the Treasurer Fall a lot of credit. This takes momentum over time. I think Treasurer Cowell had a point of view and we built some momentum there. I think Treasurer Falwell built some momentum there. So we have to continue to build on the good work they did. And I think the tactics just shift and evolve over time. So I don't want to be critical of his approach. I think it helped us get to where we can be today, where it's, we tried this approach. Now we got to kind of come back and kind of negotiate on it. Like, you don't get folks to the table to negotiate a problem unless they understand it's a problem and are pressured into accepting it's a problem. So
That's
give them a lot of credit there. I'm going to give you a lot of credit for like what you point out with the raises piece. I get it. We have people on our staff who've been here a long time, probably cumulatively have not had a 41% raise in 10, 12 years. So I get that is not palatable. I can't solve how they distribute money to their top executives versus their nurses versus the folks that are janitors.
Right.
I wish they'd let me kind of chip in because I got to work with a lot of really high quality folks over there that also didn't get raises. But we're going to put pressure on them. If you want to participate, you are going to have to make more money in volume than per case.
So this is Treasurer Briner, Tom Friedman style.
Yes, it is. But we're shooting for the same goal. Our members should pay less and the prices should be more transparent. I don't know if we would be as successful as we have been to date or are going to be without kind of what happened before us, right? So I think we're going to try to treat this like economics and kind of market forces, use our scale and offer something for the scale. I think there was more of pressure and shame. And now it is more like, hey, you want more money? This is your path to get more money. This is your path to get more members. If you don't, someone else is going to.
Yeah.
And we hope that capitalistic principles work. And like I said, I wish I could change executive compensation because there are a lot of folks, state employees and not that aren't even close to that. And how you could ask folks that change bedpans and do all these things to not get raises and to do that top shelf. Not how I would handle things. And so we're going to try to put pressure on them to do the right things by our state employees. And hopefully that ekes out into a broader set of system of things. But I'm going to control what I can control.
Exactly.
Yeah.
So it's time to put you on the spot. The question everyone...
You haven't put me on the spot yet.
You don't think any of those questions, but I think...
No, the big spot.
Oh, the big spot.
Yeah.
Now, the question there, all of our members kind of want to know, obviously, there's a lot of talk about premiums going up for the next year. Can you explain a little bit about what's happening?
Vote's happening in August, correct?
Yeah, it is... I'm going to look on my phone because I have the date. And
I think it's August 6th.
Drum roll, please.
Yeah, I think it's the next week. It is August 15th.
August 15th. But they won't take effect until January 1st,
That's right.
So
yes, a couple things about premiums. While they haven't gone up in a long time, we recognize any increase is hard and hits people disproportionately. So I think the treasurer, the first commitment he made was we are going to make sure the premium increases are the lowest on our lowest paid state employees. So that was commitment one. So I think right now we are trying to keep for the 70-30 for our lowest paid state employees, the premium increases to around $5-ish a month. When he came in January, we thought that number looked more like 20, but we've been able to make a lot of progress in some areas. And we think feel comfortable in that mid 5-ish range is what we're shooting for the lowest tiered folks on the 70-30 plan. What it's going to look like at the higher tiers, we're still trying to work out and figure out. It's going to be materially different. It's going to be $30 to $50 in some cases per month on some of those plans. And recognize that's a big change. So yes, they're going up. I think that's the approximate range, 50, 60 kind of. We'll see where we can get on that. I think it might be higher on the highest paid state employees. But if someone told me they didn't mind if my premiums or Bill Belichick's premiums went up too.
That's the first thing I thought. Bill Belichick doesn't care.
So I think some folks are a little bit more okay with that.
He's probably got NFL pension.
Yeah. He's got, I'm sure. Yeah. But I think something the treasurer is really committed to and thought about after this is like we have to rebase because we are in a financial crisis. His goal, and I think is very achievable and realistic and fair, is to tie premium increases going forward to salary growth. So I think something we learned kind of looking back at things, had we raised premiums 2% a year the past 8 years, we would not be in the financial situation we're in today. And, rather than talking $60, $70, $50 premiums, we'd be talking $3 or $4, or the numbers would be $10. And so what we are working on, and working with the General Assembly on is, let's say you make $100, your paycheck goes up $10, your premiums go up the same percentage of things. So if it was $5, if your premium was $10, now it's $11. So we're trying to keep them kind of commensurate. So what you get from your raise isn't consumed, because we've heard y'all. Because one of the things you've said a lot of times,
you hadn't heard it all the way,
hadn't heard it all,
or else it wouldn't be just state employees. If you get a raise, then it goes up a little bit. We're not seeing anything. There's no sharing in the pain from the hospitals at all.
Well, and I think that's where we started. That's where they're going to start sharing in this. When we hold the PBMs accountable for a few $100 million, that's them.
Yeah, absolutely.
And when this starts in 2026, there's going to be a lot of hospitals that not just their rates go down, that they're going to get no volume, and it's not just going to be less revenue, it's going to be zero. So that, our strategy for 2026 and beyond is really why we think we can be comfortable saying your premium increase is going to be tied to your salary increase, because we are going to continually at this approach, go aggressively after provider reimbursement. And if we're successful...
Now that makes sense to me.
Yeah.
If you're saying we're going to do this thing, and it's definitely going to have an impact on them,
Yes.
so they can play ball or not. But if we could try to avoid saying, if we had just increased premiums this whole time a little bit, we wouldn't be in this mess. Because that really makes a visceral reaction from me of, how about if we didn't pay people 4 times what it takes to make a profit to run a hospital, we wouldn't be in this mess.
I think both things are true, 100%.
Okay.
Yes.
Fair enough.
So I would say, and where we really need Scenics help and y'all's help,
yes,
we're literally talking about hundreds of millions of dollars of savings if we can get our members to choose $0 surgeries from high-quality providers. One of our goals is going to take it out of the system more, and that's going to help lower all of our costs. So when we start rolling the programs out, help us communicate, help us clarify, because I think sometimes, fair or unfair, when someone hears something's free, they think it's not good.
Correct.
Mm-hmm.
And we are trying to really take the opposite route of it's free and it's higher quality. And again, you don't trust your health plan the most on planet Earth, and I think that's reasonable and fair. But help us communicate that, and we got to show it. We got to prove it to you. We can't just ask you to say it. But that's where we're going to literally get hundreds of millions of dollars out of providers in North Carolina, just in reimbursements. And so that is the less we are going to pay. That is not even accounting for some folks are just going to get zero if we're really successful in this, right? If you want to, you can charge me 900% of Medicare, but if no one goes there, that's not a good number for you, right? So, so I think that's where we need y'all's help, and we need to do a good job of communicating this, because it's going to take a lot of communicating, because it's really different. So that's where y'all got to tell me where I need to be.
Absolutely. We'll try to be a good partner in that. Y'all are hearing it right now. So we'll try to continue to give you information on this, but you hear that they have a plan.
Are there other outside the box ways you're trying to save money for the plan?
Yeah, I do think our members are very savvy healthcare consumers and utilizers, despite it being very complicated. I think some of the outside of the box ways, we're trying to make them more in the box.
Okay.
I think, I fully admit, and I said this the first time I worked at the state health plan, we got a lot of work to do on copays and cost sharing for chiropractors, PTs, and some of those folks. I'm embarrassed to say, I pay cash at that side of care, because I think our benefit is not where it needs to be.
Right.
It is something we definitely need to tackle at a point in time, but kind of given the deficit and where we are, they just can't tackle everything in 12 months.
Yeah.
Let alone 6. So I pay cash for my chiropractor. Again, I'm in a different financial situation than everyone else. And I would never want to say, ask your doctor what they'll take for cash. Some people do that, and sometimes it's effective. But we know we have to do better there. We're having meetings this week to figure out how we can do better there. But, where you can shop for things in commodity service, I think is, generally speaking, a good rule of thumb is the bigger the building and the bigger the parking lot, the more expensive it is going to be.
Mm-hmm. Yeah.
And if you can ask, do I need to do this thing today, or can I go to somewhere not in the hospital where they're going to charge us a facility fee? If you have this mental space and bandwidth and time, and again, that's a hard thing to ask someone in the moment, it's generally cheaper and a less invasive setting.
I mean, if I'm having chest pains, I don't care.
Yeah, please don't leave. If you're having chest pains, stay where you are.
I know a lot of things aren't chest pains, but, if you're scared at all.
Yeah. And so that's where we have to make more access points. And so something we're looking at is, how do we bring care to those communities so folks can see a doctor? There's a lot of advantages to working for the state and being part of the state. One of them is we have a lot of property across the state, whether it be universities, community colleges, elementary schools.
Absolutely.
State buildings, DSS sites. Could we start bringing healthcare there quarterly.
Yeah.
I don't expect folks, I'm not going to pick on Yancey County again, but in Ashe County, there's not an endocrinologist in Ashe County, or there's not that many, but diabetes doesn't necessarily care where you live.
Right.
So how do we bring quarterly, some amount of time, doctors to those people?
Love that.
Yeah.
Because we can't ask our members to drive. And folks, I think, are excited and want to do that, because kind of going back to what we talked about scale and being one of the largest commercial entities, like those folks all need commercial volume too. So that is an opportunity where we can scale together. Again, I'm going to make you charge me a little bit less, but nowhere else is going to be able to say, I can give you a full panel of commercial patients for 3 days in a row, but you gotta help us out a little bit there, because we're going to try to cover some of the other costs of the labs. I think LabCorp is always willing to be a great partner.
Yeah.
Every imaging center in North Carolina wants to be a great partner. So I think that's the next phase of this, where we can use scale and drive prices down and make it better for members. That just takes time and logistics. And again, we're going to try, we will get to everything. It's just not going to be everything tomorrow.
Scenic can partner with you on those health fairs.
Right.
We can send some folks.
We're happy.
Yeah.
We're happy to do anything we can to help
Yeah.
get the word out or put you in front of Scenic people as much as we can.
I will be wherever you need me to be.
Well, thanks so much for joining us. We'll tell Loretta to send you out to other podcasts, because you did a great job.
Amazing.
I can just be local here, right? Can we just be exclusive?
Yeah, there's a lot right here in Raleigh.
Yeah.
So,
We could have an exclusive
Yeah,
deal with
yeah.
no one else can talk to him.
yeah, you can. Hey, you could be the fifth Beatle here if you want to. It'd be fun.
Yeah.
If you give me a stuffed animal of my favorite animal, we'll talk.
What's your favorite animal?
Oh, God. Now you put me on the spot. Healthcare is way easier than favorite animal.
Oh, yeah.
My kids will hear this, so I'll be remiss if I pick the wrong ones.
Aw.
Yeah.
Well, kids, your dad's doing a great job running the health plan, and we are really thankful to have him there. And he's a patient man as well. I will say that.
And thankful for him giving us time. And also, he came to our board meeting a few weeks ago. So.
Yeah, and thank you, Treasurer Brunner, for letting him and for just the commitment the department seems to have to solving what are perhaps the most complex problems in state government, and that is even counting DMV.
Oh, we don't want to. Do you want to ask him a DMV question?
I'm just going to say thank you for your time, and I appreciate it.
All right. Well, thank you. All right, that was an awesome interview. I hope you learned a lot from it, and we'll probably have him back on maybe August after the premium
After the
information
board of
comes out,
trustees meets.
or maybe January when it
when
it's
when
gone.
the S has hit the fan and
We'll
everyone's
have to
upset.
check in with Thomas frequently.
Maybe quarterly, since
Periodically.
the
Quarter,
board meets
we'll have him
quarterly.
his own state
I
health
like
plan
it.
moment.
I like it.
Yeah.
He's a good
He was
guest.
very informative.
Yes, he was.
Speaking of moments, it's time for the Gen Z moment.
Yeah.
What's going on in Gen Z world over there?
Yesterday, I was looking at some different articles, and I actually found one that was about how millennials and Gen Zs are redefining the American dream,
Talk to it.
which I thought was really interesting. And it talks a lot about how the American dream is still important to Gen Zs and millennials, but for us, it's changed because of the changing challenges, and we have kind of created our own modernized version of it. While 73% of Gen Zs and millennials say that it's still important to them, over 70% of those people who said it's still important believe that personal fulfillment is more important than material success in today's
Go
American
young
dream.
people. Go young people.
And they also, in this article, compared the generations and what's changed and why we've had to kind of create this evolved American dream. So some of the things that were easier for older generations, 84% said it was easier for boomers and older generations to own a home. 79% believed it was easier for them to start a family. And a majority agreed that financial stability in retirement was more accessible to boomers.
So I don't think it would be any easier for them to start a family. It would be harder for Gen Z folks to afford a family.
Yeah.
It's pretty easy to start a family, right? But I know what you're saying, and I was going to get to this. Like, that was my initial thought was, is the American dream changing for Gen Z because of these other things, or is it like a concerted effort on your generation's part to actually care more about things like that?
It's partially that we are reshaping it to align with modern challenges, opportunities, because some of the things that are deemed easier for our generation and millennials is starting a business. 71% said it's easier to start a business today than it used to be. Entrepreneurships and side hustles. The digital economy has removed traditional gatekeeps, and it's easier to make money in non-traditional ways. And so we are kind of prioritizing more of a choice and flexibility to create that personalized lifestyle.
I would agree with that. Yeah. There's a way, you can definitely work more independently than you could in our generation.
Yeah. So overall, we aren't really waiting for permission, but are adapting to the economic realities and creating our own opportunities for our version of the American dream.
Very cool. Very, very good
Awesome.
find there.
It is. I think y'all will be happier. I mean,
Yeah, in the
I hate,
long run.
y'all are our children, and we don't want things to be harder for y'all. They are.
Yeah.
But we don't want that more than anything. As parents, you don't want that.
Mhm.
But I also just hope at the end of this that all of that is true, that y'all are figuring out what to value.
Yeah.
And
I
we
think,
didn't figure that out for
No.
a long time.
I think for me personally, and my friend group personally, or a lot of us do view it more as we prefer the personal fulfillment over material success. And being like, oh, well, I may not have the fanciest house or the biggest, most important, most fun things one day, but I'll be able to say that I lived and I did a lot of things
I love
and
that.
experienced a lot of things.
That's
growing
living.
up,
That's living right there.
That's right.
which is why I spend all my money on vacations.
Well, you're working to live.
Yeah,
Like we grew up living to
Yeah.
work.
Yeah.
So
yeah.
maybe still do. Uh-uh.
Well, what else is new in Gen Z world? I did see Taylor Swift at the Tight End University
Charity event.
I think, John,
Yes.
you use this whole Gen Z thing to talk about Taylor Swift
Yeah, I think
and
so.
have it be accepted.
I was way more excited about seeing that video than Clara was. I was like, look, she's on stage with
Oh, John.
Kane Brown, who I don't know either. But
Oh my gosh, I love Kane Brown. Love him.
But he's the one that got lost in the woods, right? Did you hear that story? Anyway,
No.
that's
We
We
yeah,
digress. We
this is gonna be a long episode.
Yeah.
No, I think I was super happy to see those videos of Taylor there.
Yeah.
She seemed like she was having a great time. I don't think she gets to do many venues like that for performances anymore. Like just super small,
They're big.
intimate, have a good time.
I could see her going back to that though. I think
Yeah.
that once you do a tour like the Eras tour, which is like 3 years of craziness,
Of 30, 40,000 people in front of you.
I think that she'll be going to these, and she was in Nashville too, which is
Yeah.
her hometown, right?
Yes. Well, not
That's-
technically. I mean,
Taylor
Prince-
Swift minute.
she
Prince
moved
used to do those little intimate concerts.
Yeah.
She moved to
later
Tennessee
on
when
in
she was
his
like
career.
14 and she wanted to start the music career.
Okay, well, I guess we'll wrap up with our question of the week. Play my theme song.
John's wacky weird question of the week.
Okay, so Scenic is once again partnering with our pet insurance provider, I think, on a pet photo contest that we're going to be unveiling the winner at our convention in a few months.
That's fun.
Yeah, I think we did this about, was it 2021, and it was a huge success.
It was a
And
lot
we
of
wanted
fun.
to do it. I think the thing I remember most about this contest was that somebody sent in a picture of a donkey or a goat, and that won like one of the categories.
Yes.
Well,
Very
Pretty
cool. So in honor of the pet contest that we'll be announcing in a few days, what is your favorite pet of your whole life? I'll start first. I've had lots of dogs because I lived in the country and we just had dogs, and dogs would come up and just live with you, and that's your dog now. Right. The first dog was a beagle named Jake, and he lived from first grade all the way to my junior year of college.
Wow.
He was 17 when he died, and he got ran over in my driveway.
Oh my God.
That's how he died.
Not even a
That's
natural
pitiful.
death.
The most
Man.
country of endings for a
Yeah, it really is.
That's how my border collie died.
A pottery shopper. They always
Yeah.
ruined all the pets. But anyway, so shout out to Jake, but he's probably not my best because I don't really remember him that much. But then
It was most of your life. How do you not remember
well, I
it?
don't remember much of anything.
Well, for goodness sakes.
But
Makes me feel better.
when I first went to work at the newspaper, and I was very poor and I did not make much money, and I lived in probably the seedy section of Sanford, and I went to the pound and I got this huge black lab. Well, he was going to be huge. He was a puppy at that time, but his mom was there and she was big. And so I got this black lab that became like an 80-pound black lab dog.
Oh,
And he took care of me, and he made sure that I was safe every day, and I loved him.
oh.
But he passed away. So that's my favorite dog. His name was Bo.
Aw.
What about you,
No.
Suzanne?
So I had to say goodbye to my girl about a year ago. Lily was a red
Aw.
miniature dachshund. She was 11 pounds of sass and attitude. And yeah, she was my best friend for a long time. I miss her.
She made many appearances here in the scenic office, and I knew that would start tears, so I did prepare you a little bit for the question.
She did come to visit. Though.
Yeah.
She would sit up on my desk and just, woof.
She was a very sweet,
woof at anybody.
sweet little dog.
She was.
What about you, Artis?
Had a mutt named Bella.
Oh.
Bella, she was the best.
My cousin described her perfectly. She looked like the body of the donkey from Shrek with like a German Shepherd's puppy head. Like her parts didn't go together.
She had some dachshund in her.
She had dachshund. She was she was funky looking, but in that way that it makes it cute.
A little underbite.
Yeah, underbite.
Yeah, that can go either way. It can be really cute or not cute.
She was very adorable.
Yeah.
But she was a good dog.
Oh.
And I think, when you have pets and kids at the same time, if that pet, like you talked about your lab looking out for you, there's a picture I love of my son with his back. He was sitting on the deck with his little legs underneath him. He was probably about 7 and just sitting on the deck looking at the backyard and that little dog sitting right next to him.
Oh.
A boy and his dog.
Yeah, boy and his dog.
Dogs
and
are the greatest.
So I always think of that, those moments.
Yeah. What about you, Sam?
I feel like I should say my current dog, Snoopy, because he is like my soul dog that I truly believe my Boston Terrier sent to me after she passed away.
Oh.
But my horse, Destiny,
Oh.
she was the first horse I ever sat on. I wasn't even a year old, and my dad was up there on the horse and said, give me the baby, and had me ride her when I was like 6 months old.
That's so sweet.
And she was the best horse anyone could ever have. She was with me until I was 23. She passed away.
I was going to say, she just recently passed away.
Yeah, November of 2023. And she was so amazing. If I was riding her and I felt even the slightest thing off in the saddle, she would stop before I even noticed. She was like, I'm not moving. Something's wrong.
Animals are interesting.
If I was not sitting on her the way she viewed I should be sitting on her, even if I was trying to do some side saddle stuff, she was like, I'm not moving. You're not sitting properly.
Horses are very intuitive.
And I will move.
Yeah.
Horses are very intuitive.
Yeah. So I have pictures of me like standing on top of her barefoot and all, doing a bunch of different stuff because she just would not move if I was not doing what I'm supposed to, according to her.
Well, that's awesome.
We still have her son, though.
Okay.
Yeah,
cool.
that's my dad's horse. Yeah.
Some fam in the fam.
Yeah, he's just...
And shout out to my dogs, Louie and Ollie, they're still awesome. Louie is a great dog.
Yeah,
Ollie,
too,
man, he's okay. And I have a cat, Lucy. So
yeah.
So that's pet moment here on the podcast.
Big, full podcast.
Golly, what is going to be like an hour?
I hope y'all have enjoyed the last hour.
It's also 30 minutes.
If you're still with us, you get like swag.
It's a long episode, but the health plan stuff makes it worth it.
Yeah, the health plan stuff is definitely more important than pet talk. But
it's okay.
Nobody's still here for this part. It's okay.
I got 10 hours to sit in the car and edit it tomorrow. We're good.
She's going to be driving to where, Indiana?
Yes.
We'll be safe.
Safe travel.
Everybody stay cool in this weather.
All right. Thank you for joining us.